Are you spending more time today than you did, say, 5 years ago in the early planning stages and sort of project formation stages of the work on the operations and functionality of the spaces, as well as the capacity, the sort of conventional planning in healthcare was all volume driven, and now there's a lot of talk about values and volume-based planning, and I was wondering if that along with the ACA is driving you guys to spend more time in the formation of the work in the early stages of the project.
I would agree that there's an enormous amount of planning going into process improvements and operations workflow issues at the same time that we're looking at design issues. So 2 quick examples for the ambulatory care center that's in design right now. From the very beginning, there was a planning group that looked at how every single process in that new environment would have to be improved. Because it's very hard sometimes to incorporate design improvements into existing spaces, but when you have a blank slate, you have to ensure that you're going to be more productive. So we did that with the ambulatory care center. We also did that with the emergency department, which was actually going around and looking around the country to see who's doing it well, where are their process improvements, and really making sure that the physicians and everybody understood, all clinical staff, all operations staff understood that they would be held to a different level of performance and accountability as part of that design, that it wasn't only coming through design improvements, that there had to be some behavior modification and real process improvements. And I do want to reiterate something that Vicki said about constantly looking at those process improvements, regardless of whether it comes out of design imperatives. We, for example, have a huge initiative at the hospital called Hercules, which I actually had to ask what it stands for, which is an enterprise-wide cost savings focus, which, because in part of the ACA, but because in part of the uncertainty across the board and understanding how cost reductions are going to be manifested. So we have this Hercules project, which stands for hospital efficiency, revenue cycle, clinical utilization, length of stay, enhanced sourcing, which covers the gamut, right? Which covers everything. But we've got these work groups that are very focused, and those work groups are also very involved in each new project to make sure that those elements are being brought to the table along the way.
Just as a follow-up to the Hercules concept, are you deploying sort of lean principles in that regard? In other words, are you connecting the people at the very top of the organization who are trying to drive these changes with the people?
It's across the board. It's across the board, and quite frankly, I think it's a new level of accountability, and it's a different level of understanding what data you have, because there's going to be so much focus on data coming forward. Then we want to get ahead of that game. So whether or not we're using HCAHPS and Press 80 now to understand what those implications are, we've already started that.
Good.